Millions of Americans are still suffering from post-COVID conditions following their initial bout with the illness. Scientists say they're still learning why and how certain groups are at higher risk. But as Garrett Tenney reports, some say they don't have access to the treatment based on their race.
As the world gets back on its feet from the coronavirus pandemic, there's a growing number of people suffering from long-term side effects of COVID-19 in the U.S. Approximately 16 million Americans are now dealing with the aftermath of the virus, according to a report by the Brookings Institution. The symptoms for long haulers develop well after the acute phase of COVID and can show up as fatigue, headaches, brain fogs, and other symptoms, which in many cases can last for months or even years.
It's hard because these conditions that come on me is unpredictable. Wobble when I walk for balance, and along with tremors that comes when it wants to come.
Researchers are warning of possible health disparities where some may have limited or no access to treatment.
And minority communities will begin to see a much higher burden of long COVID over time. When people have less access or more limited access to the healthcare system, they're going to have less benefit from the innovations and the new treatments that come available over time.
With the COVID-19 pandemic disproportionately hitting communities of color the hardest, those suffering from long COVID say getting the necessary medical attention is an uphill battle, and they sometimes feel invisible. This long hauler says her limited access to treatment makes her condition even worse.
As a Black woman with long haul COVID, I feel like I've been put at the bottom of the barrel and I got to do all the work.